Good day everyone, I'm Long Er. Me and my friends are going to present for biomaterial case study A. Coronary stents are used for patients undergoing precutaneous coronary revascularization. Although the restenosis rate after coronary stent implantation is lower compared to balloon angioplasty, stent restenosis remains a major problem. What is coronary stent? Coronary stents are small wire mesh tubes that aid in widening of clogged coronary and the restoration of normal blood flow to heart. The stent is implanted into coronary and stay in place permanently to decrease the chance of narrowing again. The inner lining of coronary will grow over the surface of stent and make it a permanent part of the body.
Good day, doctor. My name is Cheng. Now I'm going to present what causes stent restenosis. Stent restenosis usually occurs when an artery that was opened with a stent becomes narrowed or collapsed again. There are two causes of stent restenosis. The first one is abundant healing, and the second one is stent is too small or misaligned. For abundant healing, scar tissue may grow underneath the healthy tissue, and the scar tissue may overgrow and obstruct the flow of blood. Then, for stent is too small or misaligned, just a little bit of scar tissue may cause blockage to the coronary artery again. So, here shows the pictures about stent restenosis.
Hello, I'm ARCHAANA here. There are three approaches to overcome stent restenosis. The first approach is restenting. The second is usage of medication. The third is coronary artery bypass graft surgery. Restenting. This picture shows the process of restenting. If the stent is not correctly placed or expanded, stent may need to be re-expanded with a high-pressure balloon. If the problem is an overgrowth scar tissue, a new stent might need to be replaced. The second approach is usage of medication. If the restenosis occurs frequently in the same area, sirolimus or serosol might be prescribed by a doctor. This medicine helps to reduce the growth of scar tissue in the artery. The third approach is coronary artery bypass graft surgery. This picture shows before and after the surgery. If the restenosis continues to occur, bypass surgery is needed. Surgery that uses healthy blood vessels from other parts of the body to go around the blocked portion of artery. One end of the blood vessel will be attached below the blockage and one end will be attached above the blockage.
Hi, my name is FATIN ALYAA and I'm going to talk to you about question 3, which is material device categorization and biological evaluation test, focusly on implant medical device plus C. At this table, we can see the implant medical device plus type C at the bottom of the table by the ISO 10993-1. I'm going to talk about all the points here at the other slides. So here we have 10 types of tests that have been done for material device categorization and biological evaluation tests for blood type C. First, we have cytotoxicity test, sensitization test, irritation test, material test, acute systemic toxicity test, subacute and subchronic toxicity test, implantation effect test, hemocompatibility test, genotoxicity test, and carcinogenicity test. About the description about every test that have been done. First, we have cytotoxicity test to determine the cell death and the inhibition of cell growth. Second, we have sensitization test which estimate the potential for contact sensitization. Third, we have irritation test which estimate the irritation potential of medical devices. The third one, we have material which detect material mediated pyrogenic reaction. And the fifth point is acute systemic toxicity, which means a lost potential absorption of toxic leachables and degradation of products. The number 6 test is subacute and subchronic toxicity. It is to determine the effect of either single or multiple exposure to medical devices. Next, we have implantation effects, is to assess the local pathological effects on living tissue at both the gross level and microscopic level. And then we have hemocompatibility test, which is to use to evaluate the effects of blood contacting medical devices or materials on blood or blood components. Next, we have genotoxicity test, is to assess the potential for gene mutation changes in chromosome structure and number and other DNA or gene toxicities caused by medical devices, material, and their extract. Lastly, we have carcinogenicity test. It was to evaluating the carcinogenicity of medical devices.
Hi, my name is Anis with HAMZAH. We will continue with question number 4. In question 4, we need to propose design consideration for the new coronary stent that include chemical, morphological and mechanical properties. In this slide, show us current generation has low profile, high flexible drug-eluting stent that offer major improvement in clinical outcome and allow percutaneous coronary intervention to be undertaken in extremely complex anatomy. In this diagram, show us the characteristic that must be making improvement and need to lower the side effect. In one of the characteristics state, radio opacity is also important to guide safe positioning, adequate deployment, and post-dilatation and permit assessment of optimal stent expansion. In these morphological properties, we use platinum chromium because they permit reduced duct thickness and it allows to reduce from 91 micrometer to 74 micrometer. It has two connector stent laser cut from a metal tube and also has two helical connector and it has wide peak at the end of each coil. In chemical properties, we have three. We use three chemicals, which is anticoagulant that inhibit coagulation of blood. For example, hydrogenate iloprost, both antithrombotic and potentially antiproliferative. Second chemical we use is anticorticosteroid that produced in adrenal cortex and used to treat inflammation. For example, dexamethasone. The last chemical we use is antimitotic agent. For example, tyrosine kinase inhibitor and sirolimus. In this slide, we talk about mechanical properties. In the material we use is platinum chromium. It has high radial strength, high axial strength, low stent recoil, and high flexibility and durability.
As a conclusion, coronary artery stenting is one of the treatment choices for patients requiring coronary angioplasty. There is a number of ongoing studies to evaluate newer stents, anti-proliferative drugs, polymer, polymer-free stent, and bioresorbable stent. The quest for ideal stents continue. Hopefully one day, ideal stent is invented and benefits everyone. Thank you very much.